By the time the person comes to me, they've seen a number of clinicians, either physicians or rehabilitation folks, and they are usually at the end of the line, not at the beginning of the line. The first thing that I look at is anything that might help to reduce pain. Because if you have chronic pain, the first thing you want to do is get rid of it. By the time they get to me, most people have already done that, but there's maybe a small likelihood that I'll think of something that someone else hasn't. Not often, but it happens. Once that's done, then my job is to try and help people learn to live with what they're left with and to be able to have a fuller life in spite of it. So if I'm successful at the end of the day, patients are more able to enjoy their life in spite of having misery, physical misery. They're able to separate out, I guess, emotional misery from physical misery. They're able to do more in their lives. They feel that their lives are more full again. And I also explain to people that if you have less pain at the end of it, it's a very pleasant side effect. My program is a multidisciplinary pain program, and it meets the criteria of this big association called the International Association of Pain, or what we call the IASP. The IASP has put out guidelines for what they term a multidisciplinary pain program is. There are a number of programs out there, but the vast majority of them do not meet that criteria. They do not meet the criteria of the IASP for a multidisciplinary pain program. Our program does. So that's one important difference, because I think those criteria are very important, actually. So that's one. And not to blow my own horn, the other part of it is that someone with chronic pain was involved in the development of the entire program, which is me. So there's nothing in the program that I don't do every day. There's nothing in the program that I haven't tried on. It's not all from a book. I live it every day, I do it every day. So if I'm asking someone to try something, I'm asking them to try something that I've actually done. And there's no group I've ever had, actually, that I don't learn something from. So I guess that's the other part. I get something out of the whole thing each time. I'm like other physicians who do this work in many ways. I'm a physician. I'm well trained. My background is psychiatry, actually. And then when I finished my residency, I did additional training specifically for the purpose of helping people with chronic pain, in chronic pain management. So that's a difference of some people who do the work. There are a number of folks who, I guess, are involved in the field who don't have the additional training. The other thing that's different is that I'm part of the population that I'm treating. I have chronic pain. I've had to date 16 or 17 surgeries. The vast majority of them are large surgeries. I've got instrumentation in my back. I've had instrumentation in my knees. I've had surgery on my hands. I got to have another surgery on one of my hands. I've had so many surgeries, when I go in, I say the usual, please. As well, on top of that, I have what's called a connective tissue disorder. It's an immunologic disorder, so it makes me sick as well. So I know what it's like to be really sick. I know what it's like to not be able to do anything. I know what it's like to believe that you've lost everything and will never be able to walk, run, enjoy your family, enjoy your friends. I know exactly how that feels, because it's really not that far away from me all the time, to be truthful. So when I do my work, I think I've learned well, and I live it. So I bring both to the table. My family and I had gone to New Zealand as part of my residency training, and 3 of my 4 sons were really small. So we were very, very busy. It was very interesting, but the flight back resulted in me relapsing. I have an immunologic disease, and I got sick. And I wasn't sure I was going to be able to finish my program. So fortunately for me, my wife Gilda is a physiotherapist, and she's the physiotherapist at that time who was in the Shidok pain program. And the Shidok pain program was the only pain program in this entire region at that time, and had been for a number of years. So she suggested I talk to the director of the program and see if there's something I could do there. And I went and I talked with him, and all he said was, come and do what you can, which is a very unusual statement in the world of medicine. It's probably a very unusual statement anywhere in work, really. And I did. I went and I did what I could, and I discovered that being not physically perfect, was actually a huge advantage in this field, because I've never had a patient ever turn to me and say, "How would you know?"